Good day, ladies and gentlemen. I'm Chih-Wen from Taiwan. It's my pleasure to be invited to be a part of this international meeting hosted by UMY. In the following session, I'm going to introduce the quality management in Zhanghua Christian Hospital in the middle of Taiwan. There are some facts that we have to know, which were inadequate quality of care imposes costs of 1.4 to 1.6 trillion US dollars each year in lost productivity in low or middle income countries. And moreover, in high income countries, 1 in 10 patients is harmed while receiving hospital care, and 7 in every 100 hospitalized patients can expect to acquire a health care associated infections. First, we have to know the WHO elements of healthcare quality is that it included effectiveness, safety, people-centeredness, timeliness, equity, integration, and efficiency. Well, we have to know that quality healthcare is effective. This means you will be accurately diagnosed and treated. In some countries, only 35% of patients get the correct diagnosis. That's terrible. And we have to know that quality healthcare is safe. This means the care you receive does not harm you. Around the world, nearly 40% of patients are harmed from the health care they received during their hospital stay. And we have to know that quality health care is people-centered. This means that decisions about your care are tailored to your needs and preferences, and you are treated with respect and compassion. Also, quality health care is equitable. This means that all people, regardless of their gender, race, ethnicity, geographical locations, or socioeconomic status, receive the good quality health care they need. Furthermore, that we have to know that quality health care should be integrated. That means if you have multiple chronic diseases, your medical care is coordinated across all the doctors and specialties who take care of you. And the quality health care that we provided should be efficient. This means your laboratory test will not be repeated unnecessarily. You will not undergo needless imaging tests. Antibiotics will be prescribed only in the case of confirmed infection. Based on love, Zhanghua Christian Hospital is the largest tertiary referral medical center in the middle of Taiwan, and there are 3 divisions in the Department of Quality Management, which are the medical quality and the accreditation and certification, and also the patient safety. If we look into the dimensions of quality that declared in the ISQA's 37th International Conference, it was divided into 2 categories. The first one is individual respective, and the second was systemic respective. For the individual respective, it includes the respects: safety, accessibility, appropriateness, and effectiveness. For the systemic respective, it includes the equity and the efficiency. Regarding the respect, that means we have to honor a person's choices, he or her needs and values. For the safety, we have to avoid any possible harm or fostering insecurities. And for the accessibility, they should be ease with which health and wellness service are reached. As for the appropriateness, we have to know that care that is specific to a person's or community's context. And for the effectiveness, we have to know that care that is known to achieve intended outcomes. For the equity, we have to know that fair distribution of services and benefits according to population need is very important. Also, optional and sustainable use of resources to yield maximum value, which can reach the efficiency of the care, is very important. Based on the dimension of the quality health care, we can divide the area of care into 5 parts, and all these 5 parts are embedded in the systemic respective and individual respective. The first one is that we have to optimize the early years, which means advancing early development and maternal health and wellness. The second one is that we have to strengthen the health and wellness. That means we have to promote well-being and preventing injuries, illness, and disability. The third part is that we have to return to health and wellness. That means getting better when faced with acute illness or injury. The fourth part is that we have to living with illness or disability. That means we have to care and support for living with chronic illness and disability. And we have to cope with transition from life. That means we have to plan, care, and support for life-limiting illness and bereavement. Then we can build the health quality matrix based on the dimensions of quality and the areas of care. So we have respect, we have safety, we have accessibility, we have appropriateness, we have effectiveness, we have equity, we have efficiency. And we got the optimizing the early years, and we can strengthening health and wellness, and we can return to health and wellness. And we can live for the illness or disability, and we have to coping with transition from life. Utilizing the healthcare matrix, we promoted many shared decision-making actions. There are various kind of topics that we designed in every kind of diseases. We discussed with the patients, and we got very good results among this kind of shared decision making, and we got many awarded in domestic or international contests. In the past years, we built up the second edition of the integrated electronic medical records. The whole system composed various kind of medical record systems, which including the physician's system, the nursing system, the operating systems, the rehabilitations, and the laboratories, as well as all kinds of examinations. And we combined all these imaging systems into this kind of systems. There are many advantages by using this kind of electronic medical record system. We have good visualization, we have good integration, and we have good flexibility, and we have communications between all the specialties. So by clicking all these icons, we can go into individual database, and all the informations were embedded and integrated. And if we want to look into the imaging studies, we can just get the results as well as the report by clicking the items. And the communications between the physicians, the nurses, or all the specialists are very smooth by using this kind of electronic medical records. Before we build up the second edition of the electronic medical records system, if we want to look into a patient's data, we have to go through at least 3 to 4 steps. for examples, we have to go into the first layer, which is emergency department physician's clinician system. And then we go into the patient list. And then we go to all the items that the patients went through. And then by clicking one of the items, then we got the final report. So there are many steps that we have to go through, and which this make much inconvenience. By using this kind of new system, we have very good access to data. For examples, for the screens, we can see all the patients list here, the name, the numbers of the medical record, and we can see the gender, age, and if there is some imaging studies among the PAC system. And also we can see the duration of their stay and the staff that who is taking care of these patients. And then we can see there are some important messages that we have to communicate between different specialties, and also some special remarks. As for the nursing staffs, we provided a very similar interface. We can see patients here, the numbers of the medical records, the names, the special remarks, and the gender, the age, and the duration of their stay. By this kind of similar interface between different specialties, we can facilitate the communication, and it is very effective and very efficient. And we can control the expected revisit or the unexpected revisit by getting all the information at one screen. And by using this kind of system, we can get access to all the data easily. For examples, we build up the clinical pathway audit systems, and we can evaluate all the healthcare quality indicators. And we also build up the critical result notification systems. These systems provided the chances that if a patient got more data, then we can inform those staff who take care of these patients very easily and very timely. And also, we evaluate and monitor the morbidity and mortality utilizing the business intelligence, so we can have all the changes into very direct and visible informations. And also, we integrate the case management systems, and all the details of the specific diseases can be embedded in all this kind of system. So from the above slides, we can see the impact of this kind of new system on our caring outcomes. That means we can enhance emergency department information system by monitoring the length of stay, and we can synchronize its information between doctors, nurses, or other specialties, and we can manage priority for multidisciplinary bed requirement. And by using this, we can integrate all the healthcare activities and all the healthcare data that we have to have. And by using this kind of systems, we can improve our key performance indicators. And here are some examples. For the emergency department revisit within 72 hours of discharge, we evaluate the numbers of the discharged patients and the numbers of the patients revisiting the emergency department within 72 hours. Well, according to the Agency for HRQ, an average readmission cost is 15,200 per patient. And by using this kind of systems, we can have a reduction in 17%, and which we can save 316,160 US dollars per month. And we also have the conference management systems. And we can evaluate all the indicators and all the numbers and lists within the quality care of the emergency department committee. Another example is that we can reduce the unexpected mortality rate by using this kind of electronic medical records system. And developing the early warning system is important because according to the literature, the regular measurement and documentation of physiological observations should be undertaken, and the frequency of the observations should be in line with the patient's clinical condition. Also, structured communications protocols should be used to assist with communication at handover and in other situations. So we developed the modified early warning scoring system in Jianghua Kuxun Hospital. Our systems included 5 factors, which were respiratory rate, the heart rate, and the systolic blood pressure, and the Glasgow Coma Scale, as well as the temperature. For examples, for those temperatures greater than 38.5 Celsius, then he will get 2 points. And for each points within 5 factors, we combine this together to get different grading lights. For the green lights, the score is between 0 to 2. And for those which score is greater than 6, then we get the red light. So we collect all the physiological numbers from the monitoring systems into our database. And by using this kind of modified early warning systems, we can output the results to the health system, to the nursing systems, and we use it into the activities of handovers. Here are the screen of our modified early warning system, information system. So we can see the patient list here. We got the numbers of medical records and the name of it and the gender, the age, and the diseases, specialties, and the stay, and all the items that should be done, and we can see the status of the meals. For the green light, yellow line, and the orange line, we can have the imaging of all the patients' clinical conditions just in one screen. And the output was not only in the physician system, but also it was embedded in nursing system and TPR trains. So we can see the whiteboard in the ward. We can see the lights of the patients, and we can see the changes of all the vital signs. And we embedded the lights, the scores of the meals into the TPR sheet. Besides the physicians or nursing systems, we also embedded the information into patient management boards in each ward. And we can see the patient here. We can have very easily, we can see the yellow light, the green light, and if we click into the patient's icons, we can get the details of all the informations. And this kind of information could be used in all the handover information system. So by using this modified early warning score systems, it is easy to manage patients' condition for medical staff, for all the physicians, for all the nurses, and this kind of system alert warning signs to remind medical staff to intervene timely to prevent condition deterioration. And also we can enhance the rapid response team function. The rapid response team activations and treatment timely. We can facilitate by using this kind of systems. We can make patients' condition stable and help medical staff to get immediate management for the patient's needs. And we can improve the healthcare quality by combining this kind of early warning system scores and the rapid response team. And by doing this integrations, we have good result of early detection of the potential deterioration of the patient's conditions. So we can prevent morbidities or mortalities or, for example, an unexpected cardiac arrest or mortalities. So by using of this kind of modified early warning score systems, we can reduce the impact on unexpected mortality rate, and it was decreased as many as 45%, and we can save malpractice compensations up to 79,000 US dollars per year. We also have the operation sign apps. We can scan the QR code of the patients, and we can see different specialties, communicate with the patients and confirm the data, and we can get the details of the patients, and these kind of details can be shown on the screen, on the wall, in the operating room, and all the specialties can see the big screens there, and can have good access to the patient's information. And we also count all the instruments through these kind of systems that can make all the procedures very smoothly. And also we use this kind of electronic medical record systems to monitor the adverse events. And the adverse event tracking and reporting systems can have a good representative to all the details of the factors, and we can have many kind of subspecialties to communicate between all this data. We also developed the intelligent dispensing cabinet in pharmacy. And all the medicines were put into boxes which have indicator lights and have monitors, sensor knob, and we have the information panels. And so we scan the barcode first, and then the indicator lights will pop up, and we can get the corresponding cabinet opened. And then we can get the right medication after this kind of steps, and then, well, they can be self-locked after the medication were taken. Also, we use this kind of anesthetic management system in our operating rooms. And by using these systems, we scan the barcode first, and then it was verified electronically, and then the machine can read back the medication name automatically. So by using this kind of procedures, they will reprint the label with the patient's name, the date, and concentrations, and all the items. So utilizing the system like the intelligence cabinet in pharmacy and the anesthetic management system in operating rooms, we can reduce the adverse events uh, gradually. So we can see the data between the 2018 and 2022, the annual medication error reporting was improved gradually. And for the high alert medication errors, we can reduce the error as many as 77% of it. So combining all the efforts, we integrate all the systems that we developed. John Christian Hospital had achieved the stage 7 HIMSS IMRAM, which is a first hospital get the certification in 2023, and it was valid through 2025. And by using this kind of systems, we can have good impact on the efficiency of the healthcare. For example, the average waiting time for admission could be reduced, and also we can look into the system timely, and we can make decisions according to the clinical care requirement very efficiently, and the efficiency was increasing gradually among these years. We also have very good impact on effectiveness. We can look into details of all the materials, and this kind of information system is available for good clinical decision making, and it is very effective. Also, by using this kind of electronic medical systems, we have good impact on workflow. So the working process is better than before, which means the workflow is getting improved gradually among these years. So this kind of information systems can help our staff to reduce their workload. And we can save all the spaces that was designed for storage of this kind of medical records, up to 1100 of square meters, and we can save lots of money through this kind of years. So it is green, it is very effective, and it is very money saving and time saving and space saving. So, according to Harvard French Dodge, we cannot inspect quality into a product. Also, Professor Deming told us that inspection does not improve the quality nor guarantee quality. Inspection is too late. The quality, good or bad, is already in the product. So we have to keep in mind that we have to make all the details in the healthcare that we provide. We have to improve all the procedures before the inspection. The General Secretary of WHO also told us that quality is not a given. It takes vision, takes planning, takes investment, takes compassion, and meticulous execution. Also, rigorous monitoring from the national level to the smallest, remotest clinic. So thank you for your attention, and thanks the organizing committee for inviting me here again. Thank you very much.